Digital motion x-rays are also very valuable for the remainder of the cervical spine, from C3 to C7. C3 to C7 can cause many problems when it comes to antero and retrolisthesis. An anterolisthesis is when the bone above slides anterior to the bone below it, and a retrolisthesis would be the opposite of that. These typically happen in specific ranges of motion. Another very common problem that we find on the digital motion x-ray that is treatable by prolotherapy and also corrective exercises is facet gapping and facet impingement. And facet gapping and impingement are pretty interesting, and I'll show you them here. These bones do not have the ligaments attached to them, but you can picture that between each of these spinous processes there is a ligament holding them together that allows a certain amount of motion in the flexion and extension motion. When we suffer whiplash, which is a rapid motion of the head backward and forward, we actually get stretching of the ligaments that hold together the bones here, and also between these very valuable spaces called the facet joints. If we were to tear our facet joint ligament called the capsular ligament, this area would have excessive opening on flexion and could really get smaller on extension, causing pinching of a nerve that can cause pain shooting down the arm and other neurologic phenomena such as numbness or tingling in the hand or the shoulder. With digital motion x-ray, we're able to see exactly how much motion is happening. So when we take the patient through flexion, we can see, wow, look, there was far too much motion between these bones, C4 and C5, C3 and C4, and we can get them into a doctor that does prolotherapy, where that doctor can position the patient appropriately and inject right into these ligaments and tighten that area. We've actually repeated DMX studies after 3 and 4 rounds of prolotherapy and seen that you can almost eliminate that kind of a problem. So this is really neat, because prior to this, patients would get an adjustment, they would do their exercises, and they would feel relief temporarily, maybe for a week, maybe for 2 weeks, maybe for a month, but that pain would return because the underlying problem was not being addressed. And while prolotherapy is still relatively new as far as its acceptance in mainstream medicine, there are not a lot of studies that show how long does this last, but we do know one thing, that it lasts years, not weeks or not months. A leader in the field, Dr. Ross Hauser, is conducting some research about this, and maybe we'll find out soon about how long that these treatments are lasting. Without DMX, we're unable to pinpoint where the injury is, and we're unable to target and tailor our treatments to get the best outcomes for these patients who are suffering trauma.